question that we're chatting about tonight, and that's can infections trigger autoimmunity, and can the titles cover Dr. Ingels' face completely? So let me get rid of that. What's up, Darin? How's it going? We're back at it.
We're back at it. Yeah, I'm really excited about tonight's talk. I think this is something that gets so missed in medicine as sort of, root cause. We talk so much in naturopathic and functional medicine about really getting to the core of why people have these issues. And this is that one aspect that I think really gets overlooked. And as I think we go into it a little bit deeper, we'll talk more about it. But it's just kind of amazing to me that there's so much research out there on how these different infections, of course, we're going to talk a lot about Lyme specifically, but Lyme and Mycoplasma and Bartonella and Klebsiella and all these organisms have this capacity to trigger autoimmune disease. And yet, it's almost like most doctors just don't know how to read, and the information's there. So I'm hoping that, you guys tuning in tonight will get a really good flavor of, what these organisms can do beyond just causing infection. And then, we'll get into, what maybe we can do about it.
Yeah, I think it's a great way to roll into this, Darin. I mean, I know you were talking about that this weekend, and hopefully this past weekend, I hope we can talk about that a little bit. Yeah, I had a pretty interesting weekend reviewing some literature on behalf of some patients, and I'm also, I think Heather in the comments mentioned, issues around mycoplasma like you just did, and I'm going to be throwing up, afterwards I'll post a couple of papers that'll help, kind of highlight what we're talking about. But Dr. Sweeto and Dr. Leckman and their group, back in September 2017, did this clinical management of pediatric acute onset neuropsychiatric syndrome, where they really highlight a lot of these things. And they talk about strep, where people originally started talking about panzas from, but then they bring in the mycoplasma and all these other possibilities. And like you said, it's in the literature. This is mainstream medical literature. This isn't, so it's out there for the docs and the other healthcare providers to really be digging into. So I always recommend that, if you're going to talk to approach one of your healthcare providers with some new information, is to bring with you, bring the medical literature. That's what we're used to looking at as doctors. So I'm hoping that, as we go through some questions, and I know that some people even sent some ahead of time because, they're over in Europe and they're sleeping right now. So I'm hoping between getting your questions answered here and then providing you with some resources, we can arm you with some medical information that's out there that'll really be able to help change the way you can have conversations with your doctors, and you can get better treatment for your children and for yourselves.
Yeah, it's funny. We talk about this being really mainstream, and when I was doing, writing my book and doing a search and looking at all of these different references, it's not like you're finding these things in the Journal of East African Voodoo Medicine. I mean, New England Journal of Medicine, the Journal of the American Medical Association. And you mentioned Sue Sweto's group at the NIH. They've done tremendous amount of research, particularly around strep. And again, this has been well documented. So I think just to arm yourself with knowledge when you're talking with your healthcare provider about, possible etiology, this is going to give you a lot of knowledge, a lot of power to, kind of force the issue that, this is something that needs to be investigated. This may be the root cause, because that's going to really redirect potentially the way your treatment goes. Because if you understand it, right, as an infection-driven, or I should say a microbial-driven autoimmune problem versus just as a run-of-the-mill infection, the treatment path might be a little bit different. So if you kind of understand what that cause is, I think it just helps you navigate that path a little bit easier.
Yeah, and it's interesting how you bring up, this is mainstream. I'm looking at that article that I referenced in the beginning here. It's in the Journal of Child and Adolescent Psychopharmacology. But if you just go to that and you hover over the authors, they're all MDs. Many of them have a PhD or a master's in public health. But I go Stanford University, University of South Florida, Yale University, Stanford, Massachusetts General Hospital, University of Minnesota, Harvard Medical School, Stanford, Stanford, more Stanford. And then we've got, DuPont Hospital for Children in Delaware, and then Sue Sweeto at the National Institute of Mental Health. These are, like you said, not voodoo medicine people. They are researching at some of the premier institutions, and it's not just like, the Ivy League schools too. We've got other institutions. Everybody is understanding that this is an issue and trying to find a way to define it better. So before we dive too far, what were you doing this past weekend? Sounded like it was kind of fun.
Yeah, so I had the opportunity. I was actually at Terry Wall's conference. Terry Wall's, they told me this is her 6th year of running a conference. It's mostly people dealing with MS, multiple sclerosis, but also other people that with various autoimmune conditions. And it was a great weekend. She brought in, a group of speakers, all very well versed in their area of expertise, to really talk about, how you can overcome MS and these other autoimmune diseases. And it was just amazing to hear the stories of, patients, talking about how diet and lifestyle and all these various therapies they've implemented outside of just drug therapy that really got them over this huge hump where they're getting their mobility back, they're getting their immune system working better, their gut functioning better. And I mean, I think one of the most amazing stories I heard, there's a gentleman there who was a professional cello player and played for the Philadelphia Orchestra. And the onset of his symptoms when he was about 40 years old, he went in for an MRI and he had 50 lesions between his brain and spinal cord.
Wow.
Diagnosed with multiple sclerosis. And this was at a time where nobody really understood what was going on. He's not a healthcare person. He's a musician by training, and he started digging in and doing his own research. Terry hadn't written her book. This was around, I think, 1980. So there was not a lot of information out there, but he dug, he learned a lot about gut and diet. He started changing his diet, and I can't remember how many years later, he went back in for another MRI, and all his lesions, all 50 of them, completely resolved. Crazy. So here's a guy with no medical training whatsoever that was able to completely reverse his condition just by really being very diligent about diet, exercise, sleep. He started studying, people who live to be 100 years old and what do they do, what do they eat, and just took all that information and applied it to his life. So, that was just one of these stories, but it was just really cool to see the power of, what we can do for ourselves to really implement true change in our own health. And I specifically talked about kind of what we're talking about tonight, the potential of Lyme and these other infections as a trigger for autoimmune disease. And it was interesting in the audience. I mean, you could kind of see there was this light bulb that went off in people's head, like, oh. And as I was talking with people, we had this conversation. Did your doctor ever test you for strep? Did they ever test you for Lyme? Did they ever test you for this? No. I was just told I have MS, I have Parkinson's, I have ALS, whatever the condition is. And that's where it stops. Okay, well, here's your diagnosis. Now here's your treatment. Where I think we're coming at this from a very different perspective. That if we can understand that these organisms are a trigger, we've got something different to do about it.
Right. And I mean, I think my God, man, that's there's a lot of information in there and it's so good. I mean, I think the thing that jumps out at me first and foremost is that you have the power to, write the course, right? I mean, it's your dietary choices, your sleep choices. Are you on the electronics really late? Are you playing video games, or are you toning down some of the electronic right before sleep? I mean, we know that sleep is critical for detoxification of your brain. We know, nutrition and proper eating, and like Terry eats like something like 9 or 10 servings of vegetables a day, which is what, like 20 cups or something. I mean, the amount of veggie this woman eats is incredible, but she went from a wheelchair to, walking around and hanging out.
Yeah, and if you've never read her story, I highly recommend you pick up her book, The Walls Protocol. She talks about her own story. She shared it again. It really is powerful. And the food at the conference follows her diet. So yeah, he ate a lot of vegetables the entire weekend. But, I think it demonstrates actually how easy it is to implement this kind of change. The food was delicious. It was done by a big hotel. So if a big hotel like that can do it for a group of 300 plus people, you can certainly do it for yourself and your family.
And I think that, I don't know, to everybody watching, I don't know how many hotels you have interactions with in terms of like conferences. I've been on boards of directors where it's always trying to get them to get the food just right. But if you come in with a clear plan, they really can make it happen. And these are places that are used to just putting muffins out and cookies. So I think that if you create a clear plan of what you're going to do, if one of these companies that's just used to just running through the motions and they don't really care much about it, they just want to get it done. Here you are caring about your own health. If you have that clear plan, you can pull it off, you know? So that's awesome to hear, man. So
yeah, no, the food was really quite amazing. We were really impressed. Oh, hey, Diane, thanks for joining us.
Hey, all right. Yeah. You know, it's nuts to me because like in the last year, the travel I've done to, you know, we've talked about some of the conferences we've been to together, and, you know, and it's just, we're on this mission to find out how to better communicate these things to everyone so that these experiences and the knowledge we have can help them and their families and their children heal. And it's just like everybody who's ultra successful, it doesn't matter whether you're a successful doctor, a successful parent, a successful entrepreneur, every single person, I go to their conference and they decide that the food is critical. And then they're like, get really good sleep and drink a lot of water. I mean, this is not a magic formula. Like, people who are successful know this. And if you want to be successful in your health, I think that that's a really great place to start off.
Yeah, absolutely. Well, you know, again, I think, you know, Dr. Wall's mantra was that, you know, we all have a choice. We have a choice of when we go to sleep, generally speaking. We have a choice of what we put in our mouth. We have a choice whether we want to move our body. So it's these choices that we make on a day-to-day basis that ultimately impact our outcome. And I think for the majority of us, if we're willing to make those good choices, you know, we do see positive improvement.
Right.
So it was
even like some of the e-stim that Dr. Walls does. I mean, I'm sure there's tons of research on all the things it can do, but it also is helping the muscles move a little bit, which is helping, you know, flush toxins out, get the lymph moving. It's helping bring nutrition in. It's getting warmth into the tissue. So a lot of times I think when we're talking about this, people are asking, well, what do you do when you can't do a lot? Yeah. You know, you do the little bit that you can do, and then you do that little bit again and again, and then you find out that little bit you just did allows you to do more. So
yeah. I'll post a video later. I actually took a video with a specific e-stim machine. I did it on myself because I still get neuropathy. I have trouble sometimes lifting my leg. And I tell you, 10 minutes on this device, I was able to lift my knee almost up to my shoulder. It was pretty impressive. So I know for people that have been dealing with neuropathy, been dealing with muscle weakness, she's a big advocate. And now really I'm a big advocate of using some sort of, you know, e-stim device to help, you know, during the course of exercise. E-stim by itself without exercise probably won't get you the result you want. But when you combine it with various exercises where you're activating the muscle while you're getting e-stim, really can have a pretty tremendous impact. And, you know, for someone who's already been neurologically impaired, this may be something that really you kind of end up doing most of your life to keep your muscles healthy. But Terry rides her bike, you know, 25 miles a day and goes on ridiculous hikes. And her mobility, you know, she just keeps saying, I get better and stronger every year. So again, I think very powerful that we've got another tool there that's accessible to help, you know, people, particularly who have mobility issues, start to get better.
And I just met a gentleman the other day. He's like, you know, for the last 9 years, they've told me I've had MS. He hasn't done much. He kind of like just eats a standard American crappy diet. Really just didn't feel well. And then he came across Terry's book, and he's like, you know what? Between her book and making a friend who really wanted to push him to help him and saw the potential in him, he changed his diet. And he said that he was like minimally effective at implementing Dr. Walls's approach to diet. And in 6 weeks, he lost like 20 pounds. And he said he had about a 20% improvement in the sensation in his feet. And this is a guy, I mean, he's just like, I just want to take a pill and get better immediately. And then they told him about the pill and he got scared shitless. So he's like, I'm going to change my diet. And it worked. I mean, and it's still working, you know? So anyway.
Yeah.
So, I mean, what about this whole thing? I mean, I think Lyme and MS is a nice place to jump off, to dive into the question. I mean, can infections trigger autoimmunity? You know, and like, what is the whole situation going on there from your perspective, Darin?
Yeah, you know, I think we should probably start talking a little bit about the why this happens. You know, there's a concept in immunology called molecular mimicry.
Yep.
And it sounds exactly what you think it is. There's something on the organism, usually it's on the outer cell wall. There's a protein, a carbohydrate, there's some molecule on that organism that's similar, if not identical, to what's in our own tissue. So what happens is your immune system identifies this, bacteria or virus as being foreign, and it starts ramping itself up to fight it. Well, when it starts fighting it, it's going after the organism, but now it's also starting to interfere and interact with our own tissue. And it can be your joints, it can be your brain, it can be your gut, it can be your skin. It can affect any tissue. And why it affects one tissue more than another, I mean, who knows? Now we're getting into really complex immunology that I don't think we fully understand. But we have mounds and mounds of evidence. And if you geek out on this kind of stuff and you really like to do your own research, you can go into the online medical database called PubMed. It's a government organization. This is where all the medical literature is basically housed. And if you type in whatever condition you want and then put "and" in capital letters, A-N-D, and then molecular mimicry, you will be shocked at how many things come up that identify, this shows what's in the research of which organisms have been identified as being potential triggers for that condition. So if you go in and type in multiple sclerosis and molecular mimicry, we'll find there's actually a bunch of organisms come up. So we know that Epstein-Barr virus is a major, major trigger of MS, lots and lots of research around that. We know that mycoplasma has been associated, mycoplasma pneumonia specifically. We know that Lyme, Borrelia, Burgdorferi has been associated. So we've got this evidence that our immune system is becoming dysfunctional. And again, we could probably have a very deep conversation on why that happens.
Right.
But, the whole concept is somewhat similar, I think, to a little bit like allergy. When your immune system starts reacting to mold or food or pollen, these are things that are a normal part of your life. But your immune system now isn't recognizing it as being normal. Something has changed, and so you've lost your immune tolerance. And ultimately, that's kind of what molecular mimicry is about: is that your immune system's natural ability to tolerate certain things gets lost. Epstein-Barr virus, I think, is a great example. We know that up to 80% of adults get exposed to Epstein-Barr virus, and if you test their blood, you'll see antibodies. But we all don't get mono. We all don't get autoimmune disease. Yet it's something that's part of us at that point. Right. So what is it that changes in the immune system that allows that virus to become, either active or to stimulate that part of the immune system that starts creating that autoimmune environment? So, I think this area of immunology that we're still just beginning to scratch the surface on. But again, I think, it's an important factor to understand as you're trying to understand your own illness. That again, is this a potential underlying cause?
Yeah, it's it's interesting. As you're talking about all that, I found the way I loved it. I heard Dr. Jones call. We talk about pandas, pans, and all what that means, but like the overarching theme is kind of an infection-caused or infection-induced autoimmune encephalitis, or encephalopathy. And I think it's really important to think of it that way because you can boil down that really complex, biochemistry and immunology and all that good stuff with all the bacteria and the viruses down to there's some infection. And I would even argue you could even just get rid of infection and just drop toxin in there. Anything that's like, like mycotoxins and stuff. But, infection caused autoimmunity and then this inflammation, this encephalitis. And I think it's important because in order to that allows us to understand the major pieces here. We have to look for an underlying cause. Right. If we don't find one, great. But most of the time you have an opportunity to do that. So look for it. Then you have to, it's triggering autoimmunity. So even if I were to treat that infection, I may actually still have autoimmunity going on. Right. Because like what you're pointing out, what allows our body to get to that point that where we're sensitized to it. And so there's something going on that gets triggered. And even if we remove the original insult and the original trigger, we could still have that process going on. And then we have to go and look at sort of what it's causing. Is it causing, MS? Is it causing a panda's encephalitis type of thing? Is it triggering more of a rheumatoid arthritis? Because, I certainly think that I see a lot of the neuropsychiatric stuff in children and teens. And as you get older, it tends, I see more presentations of, rheumatoid arthritis and lupus, scleroderma, certainly multiple sclerosis. So it's just, I think in my brain, because I like kind of like keep it like simple and in columns so that we know what path we're going down. Those three pieces are the major pieces to look at. And then you can hang your treatments in those areas and figure out like, Well, what do I do for autoimmunity? What do I do for inflammation? And what are the things when I go MS and trigger on PubMed or molecular mimicry, what comes up? So
yeah, and it's interesting because, immunologically, when you look at what's happening with the immune system, when you start going down that path of autoimmunity, it drives mostly what we call a Th2, which is T helper cells response. And that Th2 response is also the same response that drives allergy. Well, again, what's an allergy? It's an abnormal immune reaction to something that's a normal part of your environment. So, and I hear this history in my own patients where, after they got exposed to Lyme, for example, now they become hypersensitive to food. They become more sensitive to mold, pollen, chemically sensitive, environmental, EMF sensitive. They didn't have any of that prior to having to get exposure. So, there seems to be this tipping point, after having these certain microbes, that it shifts the immune system in that way that, drives that Th2 pathway. And it's pretty interesting because, again, we've got some really good evidence in the literature about even nutritional things that we can do to start tipping the scales. This balance between Th1 and Th2, Th1 is kind of that response that you get when you've got an initial infection, and that part of the immune system that directly identifies it, starts munching it, gets rid of it. That's more Th1, where more Th2 is more kind of antibody production. But what happens is as Th1 goes up, it secretes chemicals that suppress Th2 and vice versa. So once your body kind of gets in that cascade of being Th2 driven, it starts to suppress Th1. So, certain nutrients out there, there's good evidence on glutathione in particular, helping tip the scales away from Th2. And I think, most of our Lyme patients do well on glutathione for various reasons. It's nutritive to the nervous system, it's antioxidant, helps with liver detoxification, but it does help tip that scales from Th2 back to Th1. Resveratrol, that stuff you get from the skin of red grapes, has also been shown to help, tip the scales. So we've got these handful of nutritional.
How about red wine? The question we all want to have answered tonight.
Yeah, should we just be drinking more red wine? Is that really the answer? Yeah, I don't know.
I'm just hiding my glass behind the screen here so nobody can see, but I'm going Th1 all night. Hey there, Lori. Hey, Dawn. Thanks for everybody for joining us. Yeah, it's funny. I mean, because so much of this stuff we see, it's like, you read, oh, use glutathione. Oh, glutathione's bad if you have this mutation and this thing and that thing. And it's like, so there's so much information out there that I think it's like why it's so important to have these conversations, and then also like, be seeking out a provider who's experienced in this, because maybe a child with autism might respond and certain genetic mutations might respond different to a child who was previously neurotypical, who now has PANS from Bartonella or from Lyme or something like that. So it's complex, which, kind of stinks, but that's what we're here to talk about. So, with this whole autoimmunity thing, I want to kind of dive in a little bit to, PANS, which is the pediatric acute onset neuropsychiatric syndrome, because I've had some cases over the years, and one really recently where I think it's important to go back and look at the diagnostic criteria, because it's super important. And I was unfortunately have to get the opportunity to talk to state departments of health and attorneys and other doctors and share this information with them. So I want everybody to know that it's out there and that they can find it, which is why we'll post some of these articles, because, pediatric acute onset neuropsychiatric syndrome, or PANS, is sort of defined by this like acute sort of really rapid onset of OCD or eating restriction. And this is a point where, I think it gets missed a lot. We have food restriction, not because somebody's anorexic or bulimic. I mean, there are possibilities of all these things, but these aren't, eating disorders. These are acute neuropsychiatric changes that present as like a overnight eating disorder, or the onset of OCD. And then we also get a bunch of other things like anxiety and separation anxiety, emotional lability and depression, aggression, irritability. Rage is super common, really severe oppositional behaviors. One of the other things we see a ton of is like deterioration in school performance. It can look like ADHD. You could have a kid who has ADHD who's in a standard school setting, and then you put PANS on top of it, which is just a mess. But then it's like your memory, kind of goes downhill, and the school performance goes down. We see tons of like sensory and motor abnormality, like they can't tolerate it. And then certainly tics, we have vocal tics and auditory tics and, hand flapping tics sometimes. One of the other things that pops up though is we often will have urinary frequency or return of bedwetting after bedwetting had sort of ceased. So these are some of the things that we should be aware of, but it just a couple of cases recently, and that really just stuck in my mind. I just had to like interject for a minute. Food restriction is a part of this, right? And it's not always associated with this, but it's a possibility. And so, I've certainly seen people where I have to treat them for months and months and months, where it's like you have a diagnosis of PANS from mycoplasma, and then we're doing these changes, and we see little changes, but it's not this huge aha moment like where everything just shifts 4 weeks into treatment. But then like 9-10 months later, they're coming in with bringing a picnic with them after all they're doing is drinking like Ensure and having a piece of bread. So, one, food restriction can be part of PANS. And the other thing is you can get better.
Yeah.
Which is critical to know.
Yeah, no, I see a lot of kids in my practice, and PANS has become increasingly common. I think it was initially called pandas because we thought it was associated really just with streptococcus.
Right.
That strep is just one of many organisms that can trigger it. And I think, I'm hoping that we start moving that definition away even further from just being pediatric, because there is an adult version of PANS that doesn't really fit yet. But I think, the nature of what you described, when you talk about this acute onset, anxiety, OCD, panic, tics, these things that come really out of the blue. And I'll give you just a quick example. One of my patients in Connecticut, an 8-year-old boy, had very classic, overnight, literally, this is a neurotypical child, had, few allergy issues, but otherwise pretty healthy kid. And within a couple of days, started developing anxiety, OCD, and tics, facial tics, and vocal tics. And so the mom brought him in, and I tested his blood. And as I expected, his strep titer was sky high. And I said, hey, this is classic, PANS or pandas. And we started treating him really for strep. And surprisingly, he didn't really get a lot better. And a couple of visits into it, mom finally tells me that, well, he had Lyme disease when he was 4. Remember, he's 8 years old. But he was tested, he was treated. And as far as she was concerned, Lyme wasn't an issue. Well, when I started redirecting the treatment towards Lyme, his symptoms completely went away. And so that was a great example for me that, sometimes the test bamboozles us a little bit. We think it's one thing. So I think what really happened in his case is that he had this underlying Lyme that had probably been dormant. He got strep, and his immune system started getting activated. The strep, for whatever reason, it really became a catalyst for the Lyme to start to become more problematic. So strep was really just the trigger, but not really the cause. And once we got to the root with the Lyme, surprisingly, I gave him a thing called LDI, low dose immunotherapy. I gave him 1 dose that night. He got a monster headache. Mom called me in a panic. We worked our way through it. The next day she called, all his symptoms were 100% gone.
Wow.
And it's been now about 2.5 years, almost 3 years, and he hasn't had a relapse since. So,
dude,
it's interesting. I was at a conference with Sue Suedo about 1.5 years ago, and she was talking about testing for PANS. And we were all kind of distraught when she said, look, you can do testing, but it's not very helpful. We're like, oh, well, darn, because what else are we supposed to do? And she's like, well, you just treat it. You just treat it based on symptoms.
Well,
and that's a way to do it, but I think I still like to do testing.
Well, I think that the thing with Sue, and I've been on committees with her, and I mean, what a riot, and it's like sitting on a committee with her and like Madeline Cunningham and stuff. It's like, who's at, University of Oklahoma working on the Cunningham panel and trying to do research to see, can we get better PANS testing? It's just crazy because they're used to the model where we do the standard test and we find the answer, whereas we're used to digging deeper and looking because I go back, I do a lot of lecturing on co-infections, both just groups ask me to do it, and I do it for the ILADS Lyme Fundamentals program. One of the things that we'd like to point out is that none of our testing has been validated in more than one infection. So if you have a mycoplasma infection and a Lyme infection, we do not know if either one of those tests are as valid as we say they are, right? And it's like if you have 2 and 3 and 4 co-infections, we don't know whether that test is as valid as when it's a standalone, which is kind of scary. So it's just crazy. But, there is a lot of hope. I mean, there's a lot of research going on. I mean, like we were saying, so Yale and Stanford and the National Institute of Mental Health. Dr. Cunningham published some studies with an Italian group where they were talking about the response to IVIG treatments. I mean, there's a lot of really good stuff going on, and a lot of the like my local pediatric hospitals are even. The infectious disease docs and the chiefs of pediatrics are actually treating 4 PANs with extended courses of antibiotics, even when some of the tests are negative, based on the diagnostic criteria, and then reassessing and seeing that children are getting better. So there are people out there doing that. Just real quick, shout out to, we have a whole bunch of cool comments, but I shout out to Sally and Maria and Jeanette and Craig, and we've got Shelly from New Zealand who just came into the United States today. We're glad they let you in, Shelly, because you're the best. And Buffy's there, and Julie. So thanks everybody for joining us. I mean, we're just this is a cool conversation, for me, because I just want to make sure everybody's aware of not only that it's out there and there are things to do about it. We're going to talk more about diagnosis and treatment, but there is hope, and because everybody's going back to the research and we're saying, how can this research help our children who are suffering get better? Like Sue Sweeto, I mean, she's like saying, these children I see have a problem that is treatable. We need to know more. But in the meantime, we should treat them. Right? We should not just wait 35 years until the science may or may not catch up. But it's the work of people in these mainstream institutions who are pushing really hard, as well as people like Darin and myself who are pushing hard for your kids that are making this happen. So it's just really nice to be able to share good news. We just hear all the bad news and, they're trying to take away bioidentical hormones, and there's all this, you can't get if your child has a real vaccine injury, we can't get an exemption unless they're going to die. And it's just kind of like blows my mind that there's so much negativity that's so easy to come across. There's actually a lot of doctors and a lot of medical institutions and universities really working hard on this too, which is nice, so it's not just us sort of in the trenches fighting, and it's not just all of you who may have children or family members with this or personally be suffering. So
yeah, I'm just reading Buffy's comment here. She says that her son's ticks come and go. They can be gone for months. She has Lyme. Of course, pediatric doctor says normal transient tic disorder. Well, yeah, I get kind of upset with these vague diagnoses. They don't really tell you, again, the why. Yeah, okay, yeah, it's transient tic disorder because it comes and goes, but is it possible that strep, Lyme, one of these things, is the root of why they come and go? I think, the nature of a lot of autoimmune issues related to bugs is always a function of how well your immune system's, working.
Just look at the MS you were talking about, right? Lesions are known to come and go. Symptoms can wax and wane, particularly in earlier phases. Going back to like where I talked about infection-induced autoimmune encephalitis, one of the things I want to make sure we point out is and where you're talking about, hey, your child, that kiddo you saw who was from Connecticut with, who had the strep and then the Lyme came out, kind of thing. You needed to treat the Lyme to get better. A lot of times people are like, hey, my kids, got strep, had a panda situation, and then the strep was treated and got better, but then like had another exposure, say maybe got Lyme, and now they have the symptoms, or they went back to school and somebody had the flu and they triggered their Lyme got worse. I'm like, well, maybe your Lyme didn't get worse, but the panda situation could. And when we look at, we have a trigger, we have autoimmunity and inflammation. if we get rid of that original trigger, but we don't heal the inflammation and we don't heal the autoimmunity, a different cause of inflammation can trigger the same symptoms to come up, right? And I think it's important. So when you're looking at these transient tic disorders, it kind of comes and goes. As one is, we know, I mean, I just saw somebody the other day, they're like, I'm great for 3 weeks. And then for a week, I feel like crap. And then I feel good for 3 weeks. And they've been going, I mean, in like the 1 week is like classic Lyme symptoms. And then they're kind of pretty good. And, you know, not everybody presents that way, but these bugs have been around, like Lyme, you know, the Borrelia species that can lead to Lyme has been found in ticks that are over 13 million years old. Right. These things know how to hide in our bodies. You know, there's all this talk where the government messed with it. That may or may not be true, but we know that they can persist. We know that there's an issue that they have strategies to kind of hide. And then when your defenses are down, they can come back out. And that's a lot of what we see. You know, and I'm not saying some kids don't have ticks. I mean, I've seen kids have nervous ticks, you know, but at the same time, if we just blow it off, oh, it's normal. I mean, I see like the little skinny boys with the normal stretch marks that look like a tiger claw across their back that are bright purple, but they're not in skin planes. It literally looks like they were attacked by a tiger.
Yeah.
How is that normal? I mean, it's just, and especially then you go and you treat that if they happen to have Bartonella henselae infection, and then you treat them, they usually go away. So how is that normal? You know, I mean, so to me, it's like I don't think we blow off the possibility that it's normal or it's a developmental thing. I mean, but we also have to look at the other things. You know, we're taught differential diagnosis, where we want to look at the most likely problems and the most deadly problems, or the most, you know, that could cause the most problems. And then we have to, but we just don't go 1 and 1, you know, we do 5 or we do 10 or 35, depending upon what it calls for. So we need to dig deeper, I think, on a lot of these things.
Yeah. I saw Sally Joe brought up a really good point, asking about blood tests sort of indicate autoimmune disease. You know, I think it's really important to understand that a lot of the blood tests that are available looking at what we typically think of autoimmune disease, so things like lupus and rheumatoid arthritis and scleroderma, there are specific blood tests associated with those conditions. When we start to see autoimmune reactions due to Lyme or strep or mycoplasma, almost all of those markers come back normal. So the type of antibodies that are being produced are not typically those antibodies that you're measuring for those other autoimmune diseases. So, you know, I think that's important to understand when you're talking with your provider, because if you're trying to investigate deeper about, you know, the why, and the typical doctor rheumatologist is going to run an ANA, then run a rheumatoid factor, CRP, and 9 times out of 10 they come back normal and go, well, okay, well, you don't have autoimmune disease. I'm like, well, no. I mean, all they've ruled out is you maybe don't have lupus or you don't have rheumatoid arthritis, but it certainly doesn't exclude the possibility of microbial-driven autoimmunity. And the one thing, Tom, you've probably seen this in your practice too, we'll see sometimes this very low-level ANA.
Oh, my God.
Technically positive, but all the confirmatory tests for lupus and rheumatoid arthritis and all that is all negative, and the ANA is barely there. That I do see pretty common when I see a microbial-driven autoimmune reaction, but doesn't fit the mold of what we typically think of autoimmune disease. So that's a pretty common scenario. But again, if you've been to the doctor and you've had all of these blood tests and they're like, well, no, you don't have autoimmune disease, yeah, that may only be partial thing. Unfortunately, a lot of these antibodies that we have identified as being triggers, they're all done in research labs. They're not done in commercially available labs. So, you know, we just don't have access to the kind of tests we'd probably like to really pinpoint, you know, what Lyme's doing to your immune system or strep. I think that's something that's coming down the pike. But for now, you know, we just have to look at, you know, do we have evidence that you've had exposure to this organism? And, you know, do you have the clinical symptoms to support it? And then we kind of put 2 and 2 together. And I think for us as clinicians, that's sort of our basis of, you know, moving forward with treatment.
Right. Yeah. And Tasha, I'm sorry to hear that all your daughters have pandas pans. I mean, it brings up an interesting thought. And then also, I know Melissa had a question here that I'm going to circle back to. But, you know, a lot of times, I mean, I don't know how your practice is, Darin, but I see a lot of families, right? and people are like, oh, like, it's like, that's where we start to think parents are hypochondriacal and stuff, or, and all that kind of good jazz. And I'm like, well, I think there's genetic components there potentially, kind of like to Craig's point about heredity and stuff, but also like there's environmental factors, right? I mean, you can do something as simple as, do you all live in a house where Wi-Fi is on? Well, I think most people leave it on at night. I mean, we don't, but a lot of people do. So maybe we can cross that out. But, sometimes, like, I have some family who have 2 kids who have had behavioral disorders. One was really severe, one not so much, but they live by these high power lines. Right. And then you could have mold in your house, or maybe you go camping in the same place, or you play in the same yard where you got Lyme disease, or one kid goes to school and gets this strain of strep and then brings it home, and unfortunately, or mycoplasma or whatever. And sometimes we see that it's a lot of the members of the family. And I've also seen some where it's like kind of like mom and 2 or 3 kids are really sick, and then dad and the other kid are kind of like just a little sick but not bad, kind of like what you would expect to be, quote unquote, more of a normal reaction to that infection.
Right.
So I think we see a lot of that too. So I mean, what's been your experience in terms of families and all of this?
Well, I think, because families share the same environment, they often have similar environmental exposures. It's not uncommon that one family member starts developing a set of issues, and somewhere down the line, typically what I see is the mom often has a history of some sort of autoimmune issue. Then it's one child, then it's the sibling, and then however many siblings. For some reason, at least in my practice, the men, the dads, they tend to be spared most of that for whatever reason. We know with autoimmune disease as a whole that women kind of outpace men anyway. So statistically speaking, women are more affected than men. But I think it's a little scary, the fact that we're seeing more children developing these autoimmune kind of issues. And again, we could probably have an entire other conversation. That might be a good talk to talk specifically about children's health, just because we're seeing, sicker and sicker kids. And therefore, I think their disposition towards autoimmunity has gone way up.
Well, yeah, I mean, I think it's like, I told somebody today, like, I remember, like, when I was a kid, like, my dad was kind of stressed for work, but he'd come home and be kind of pretty chill, except for once in a while when the money was tight. I mean, I feel like my 9-year-old probably has about as much stress as my dad had on most work days, right? And the amount of stress that we're seeing as adults is ridiculous these days. And our whole society, I mean, stress is the #1 cause of inflammation in the developed world. I mean, bar none. And it's like it's just like driving down the road. There's so much negativity and anger and stress. Our adrenals are shot. Our endocrine system shot. No kidding that we're more susceptible to disease, and to acute illness and then chronic illness. And it's like I'm just seeing like our kids are like married to their tablets and their phones, and we've changed so much in what our environment looks like technologically in the last couple of years that, evolution might take some big jumps, but it doesn't seem to have been able to do it with the cell phones and all that other stuff yet. And I'm not saying they're bad. I'm just saying it's a huge stressor on our systems. So it's one of the things where, I mean, And I think that this is where it's hard too. As adults and parents, we have to model this behavior for our children, right? Which, means we have to like use our stuff less. We have to do the stress relieving things. I mean, I felt so good yesterday. I came home and I was a little tired, a little bit stressed, and it was a good day, but I had to do a lot of extra work. It was one of those days where it's kind of like positive stress. You're tired out, but you did the right thing and it actually worked, But I got home and I was like, man, I was going to exercise, but maybe I'll calm down. And my daughter's like, what were you going to do? And I told her, and next thing you know, like 10 minutes later, all 3 of us are down working out, lifting weights and doing, fun stuff. And she's got her bandana on. And I'm like, but if she said, hey, what are you doing? Do you want to do it with me? And I'm like, oh, I'm so tired. And I didn't do it. I just lost that golden opportunity, So it's cool where we have those chances to teach that stuff. So that's definitely one. And maybe we can even get like, Elisa to join us or something, Elisa Song. I mean, she's a great pediatrician who sees a lot of the stuff we do. And I think we all have different takes on this and we live in different parts of the world. So maybe we get a panel to talk about children's health, because I mean, I think having a 9-year-old, I want to know everything I can, but also it's just, that's what we do. I mean, it's like you hate seeing anyone suffer, but especially the children. Melissa had a question, and I think it's it's a really good one that can help us sort of tie together some of what we talked about, and then maybe move into some of the questions that we got submitted ahead of time, and really into treatment, because I know we both have a lot to say about that, and you have a huge section on your book about this. But Melissa was asking about gastroparesis with food restriction as part of Lyme and pandas, and it's like, some people have sudden onset of food restriction, burping, hiccups, gagging, and nausea. So,
I can't say, at least in terms of the PANS or pandas, I can't say that that's been something I've typically seen as part of that syndrome.
Like the gastroparesis part?
Yeah, the gastroparesis. That's not something I typically come across. However, we definitely know that Lyme has the capacity to invade the gastrointestinal tract. We certainly know it has the ability to incapacitate a lot of the nerves and cause a lot of nerve issues. So, much like along the lines of MS, we start to see, urinary bladder problems, urinary retention, either gastroparesis or at least slow peristalsis, fecal incontinence, all these kind of things can be associated with Lyme because of that neural inflammation. So often it really is a central nervous system problem, and it's just the downstream effect of what's happening there. So it's really not much of a stretch. Fortunately, I said it's not been something I've seen a lot of, at least as part of PANS. For me, PANS, it's really the big character. We talk about a lot of different symptoms, but the ones I tend to see over and over and over, it's the OCD, the anxiety, the tics. Those tend to be the
rage,
yeah, those tend to be the ones that tend to be more dominant. But again, because of this, inflammation that can happen in the nervous system, really, we're all different, and it can affect people in different ways. So it's really not much of a stretch to consider that could be part of the problem. Definitely.
Yeah, I mean, I certainly see a lot of gastroparesis, but I would say not so much related with PANS. But the sort of the burping, hiccups, and nausea, I see a ton in my PANS kids. I've also, though, seen people who were being treated with IVIG and antibiotics for PANS, who, because they had a hiccup, burping, sort of belching tic, that turned out they had SIBO. And after like $150,000 worth of IVIG, which is purified human blood products, we started treating with the appropriate medications for SIBO, and the symptoms essentially resolved within a couple of weeks after, a very long period of having issues, and, there's some stumbling blocks after the initial success, but it really looks like it was more that SIBO thing. So again, we have to go back to that differential and look. And one of the other things, though, too, is like, if there's anything out there that could cause a PANS-like syndrome and not cause an autoimmune encephalitis, I think it's Bartonella. It's just kind of like a lot of the rage and the OCD and the sudden onset and these weird behaviors do seem to come from Bartonella. But the other issue is Bartonella infection can also trigger PANS, which is kind of like, to me, like the double whammy from whatever the heck that show was back in the day. And in the comments, I did post a couple of papers, including the one, the case that Dr. Breitschwart Mosiani and Alan Lewis, who's trained with me, and a couple other folks have put out earlier this year on PANS in a person with Bartonella, and all of the treatments that were done to modulate the immune system, and antibiotic protocols that were not fully appropriate for Bartonella, that subsequently, once treated with the appropriate antibiotics, the child went back to being, their pre-infection baseline, which is really good. So, I mean, some people, I think the thing is, it's so important that the sooner we can get to a diagnosis, the sooner the treatment, can work. So we had some questions about treatment, and I know I think it's important to talk about that. Taking a couple notes, so we don't miss it. And I wanted maybe to dovetail, because I don't want to forget the question that we got submitted ahead of time from England. So we greatly appreciate it, from Daniela, but she's talking about antiphospholipid syndrome. For having it for about 30 years. And the rheumatologist basically said, even if an infection triggered it, you can't turn off the autoimmunity once it's triggered, and they'll probably always have antiphospholipid syndrome, even if the Lyme is cured. And so kind of like, what are our thoughts? What's our experience in reversing sort of long-term autoimmune illness?
Well, I think that's the difference between conventional medical thought and what we think. So I think there's this attitude in conventional medicine, just that, autoimmune disease is what it is. You can't stop it. All you can do is slow down the progression. They say this with MS. They say this with lupus. They say this with rheumatoid arthritis. We can't stop it. We can't reverse it. All we can do is slow the progression. Right. And I think those of us in our world think differently, and we see differently, because we do see people who are able to reverse their autoimmune disease. So again, I've seen people that have antiphospholipid antibodies. They're very non-specific antibodies. There's a lot of things that can trigger it, including Lyme and all these co-infections. I have seen people after they've been treated, and you treat the gut, and you treat their toxicity, and everything else. When you take that whole body comprehensive approach, we do see those antibody levels drop. I've seen ANAs go away. I've seen phospholipid antibodies go away. I've seen specific neurological antibodies go away. So again, I think as you get the body healthier, you're able to shift that immune system in the right direction that starts down regulating that immune response. So, I think we're trained differently. Our experience is different. And because, the neurologist, the rheumatologist, they're really very, typically drug oriented in their approach. They also haven't tried these other things. I know very few rheumatologists and neurologists that are doing a lot with diet and gut health.
And believe it or not, gastroenterologists are not suggesting that you change your diet to help your gut.
Yeah, again, it's one of those things where there's just, now mounds and mounds of literature showing how important the gut is pretty much for every single chronic illness, heart disease, diabetes, cancer, you name it, there's an association. So not much of a stretch to consider that, this plays a big role in, any kind of autoimmune condition.
Right. And that reminds me, I wanted to make sure I let people know, I'm going to be announcing in a couple of days in our Facebook support group, Empowered by Lyme. I'm going to be doing a live event called Healing Lyme Brain, where we talk about exactly this. We're going to, talk about Lyme disease and brain and other infections and just general health, but mostly like, how does the brain detoxify, and what is the role of the gut in detoxification, and very specifically in creating and retrieving memories. Yep. And it's amazing, so like basically if you want to be healthy, it starts with your gut, right? It's crazy. I'm just thinking the other day, I was telling my daughter a story, osteopaths back at the flu epidemic of it was 1918 or something like that. A lot of the conventional doctors were having very high mortality rates, and then the osteopaths were having extremely low mortality rates. So people with this influenza were dying with regular care, and osteopathic care was, back then, seemed to have something different. And what they did was, believe it or not, they told them to open their windows and get fresh air. And they said, when you're able to walk around, I want you to start walking around and then get outside so you can walk around when you're healthy enough. But before that, we're going to have your family manually move your feet and push on your chest to do a lymphatic pump to just get the fluids moving and get your breathing changing just a little to kind of help your body simulate like what a lot of people do with rebounding or e-stim or vibrators these days. It's like, the whole idea is get some fresh air, get some good water, pee and poop normally, eat some food, and move your body.
Yeah.
And it made a massive difference in the death rates between the two groups, So it's interesting. And I've certainly seen similar things too with the, where you mentioned before, Darin, about the low ANA and then the non-specific antiphospholipids. Some people just have these that stay low, and I would love for them all to go away. But I see them kind of trickle along. But if they don't end up manifesting as anything, maybe it's a marker you have. I would love for it to go away. I would certainly challenge everybody who still has any autoimmune markers to see if there's one more step they could do to get better. But when it comes to treatment for sort of infection-induced autoimmune encephalitis and things of that nature, sort of kind of what are you feeling with that? And certainly at the end, I wrote down some notes. Sarah has an awesome question about palliative treatments and sort of concomitant treatment with some neuropsychiatric stuff. So we'll dive into that a little bit later.
Yeah, I always get concerned. I mean, the conventional approach, if you've been diagnosed with, most autoimmune conditions, is something suppressive. So either it's, short courses of steroids, it's antibiotics, it's IVIG, all of which come with, a pretty long list of side effects. And I don't know that really any one of those therapies really gets to the root cause. And I get so frustrated because I see so many, particularly kids with PANS, they go on these courses of antibiotics, generally very long term. I mean, it can be 6 months, 8 months, 9 months, a year or longer. And of course, in the process, you're damaging the gut, you're damaging the mitochondria. And then, may do well while they're on the antibiotics. Their symptoms, go down, but they come off. And then within a matter of days to weeks, they're flaring again. And now they're worse than they were before. So I'm much more interested, how do we get over the hump long term? And again, for me, it's the same kind of process as we talk about in treating Lyme, in that, we've got to get the gut healthy. We got to make sure that there's no leaky gut or a way for these very stimulating immune proteins to cross that membrane. I think diet is hugely important. What you put in your mouth does make a difference on your disposition to controlling inflammation. And then beyond that, I mentioned a little bit about some of these nutrients like glutathione, like resveratrol, things that are going to help start flipping the Th1 to Th2 response. And then beyond that, I think, one of the most effective therapies I found is what's called low-dose immunotherapy, or LDI. And if you guys have never heard this term before, it's I'll say a relatively new therapy. It's been around maybe for about 6 years now. It was developed by Dr. Ty Vincent. He's a medical doctor in Hawaii. And the principle on it is really kind of the same as if you were treating an allergy. And I think what we see immunologically, again, is your immune system is starting to treat these bugs as allergens instead of pathogens. There's a very specific immune pathway that gets stimulated when your body thinks it's something that doesn't belong. It's a pathogen. That goes down one path. But if your body sees it as being an allergen, it's a completely different part of the immune system that's engaged. And again, that's the part that drives more of that autoimmune reaction. So what we really want to do is retrain the immune system to stop thinking of it as an allergen and think of it as potentially a pathogen, or just think of it that's normal and leave it alone. So basically LDI is we take an organism that's dead, it's been irradiated, so it can't reproduce, it can't cause infection, it gets diluted out, hundreds of thousands of times, and then it's mixed with an enzyme called beta-glucuronidase. And when you mix that enzyme kind of helps modulate whatever you mix it with. So whether it's strep or Lyme or candida or whatever it is, and then you just place it under the tongue, and we start with a specific dose, and typically we start with a very weak dilution. Kind of like with a medication, you might start at 1 milligram and then go to 10 and then go to 100. You kind of build your way up slowly until we find that therapeutic dose. And what we find is that, when we hit the sweet spot, usually within 24, 48 hours of getting their dose, people notice that there's some level of improvement. And then from there, we just kind of keep fine tuning it. So it's really been a cool therapy in our office. And we found a lot of people have really responded quite well to it.
Right. Yeah. I mean, I have a similar experience. I don't really do LDI, but all the other things you were talking about, I think are important. And a lot of people who have worked with me will see that there are times where I do incorporate antibiotic therapies, but I'm always talking about, protecting the mitochondria, improving detox, using the glutathione, protecting the gut and rebuilding the gut. I mean, anybody who sees me, I want your gut to be better when you leave than when you came in. And most of the time, if you're on antibiotics, your gut will still end up being better while you're on the antibiotics than before you walked in, because it's so important. But a lot of times I'll do a combination, and my goal is to get, whoever I'm seeing, I want you to feel better as quickly as possible and get stable. But I know that, like Darin's saying, those antibiotics just aren't necessarily going to do it long term. And so that's where I'm using different herbals, and we're layering things in. And almost always herbals are on way longer than the antibiotics, because they work in such a supportive role, and they do get to that underlying cause without that other damage. But there are children where, I've had them on antibiotics, 2-3 of them for like 10 months or a year. And it's like, I can't even believe I say that out loud, but they're very specific cases that specifically needed that, and it worked. And we also were using herbals, and we transitioned into more herbals so we could get off of the antibiotics. And if there was a flare and we had to go back on, then we got stability with the, like, I find that like antibiotics are oftentimes, when in the right person, they can be stabilizing, but like you're saying, Darin, they don't always get the job done. So, and sometimes they do, but I find that I often need to put in a couple different herbals and come at it from different perspectives that way. And then I can get the antibiotics out of the way and then slowly taper off the herbs. And while we're doing the whole thing, then we're working on all these other things. So, and so that, I think that, we've said it a million times, but diet's critical. There are other things I found that, certainly a lot of the folks who know about pandas and pans know that, in a flare, things like, ibuprofen can be very helpful in a select group of children, weight-based ibuprofen around the clock when they're awake. It doesn't work for everybody, but it helps a lot. CBD oil, particularly the over-the-counter kind, not the medical marijuana version, is often effective. You just got to get the right dose. Adults need to be at 25 milligrams twice a day for the most part, and kids, we just kind of have to back down to a weight appropriate thing. But I think those are important. And I found that in a lot of people, low dose of naltrexone helps quite a bit to help modulate the immune system. And I mean, my recollection is you've got some experience with that too, right?
Yeah, I didn't mention that. I use a lot of low dose naltrexone. I mean, I'm a naturopath. I'm supposed to tell you that drugs are bad, but I can tell you this is one that has a very low side effect profile, which is virtually none. It's very well tolerated. It's very inexpensive. And again, we've got several small studies out there for various autoimmune conditions, but by and large, we do find there's clinical benefit. So I find, it's definitely worth trying just because of its, potential impact, low cost, low side effect. And the other thing, you mentioned earlier about herbs is that, remember with herbs, unlike antibiotics that are really just there to target the organism and stop it from replicating, herbs do a whole bunch of other things. They're anti-inflammatory. They help boost your immune system. They're soothing to your GI tract. They help with cellular repair. So you're getting a lot of bioactivity from various herbs, depending on which ones you're using, that you're just not getting with the antibiotics. So I think when we start using herbal therapy, we're killing more than two birds with one stone because we're getting all these additional effects. And I obviously start with herbals when I'm dealing with any type of autoimmune issue, particularly if we know it's microbial driven, just because, again, we can target the organism and get all these other benefits at the same time.
Yeah, it's interesting. Myself and Catherine Lanceman, along with Dr. Lee, who runs Milford Diagnostic Labs, back, I think it was 2014 or something, we published 4 of the first 24 cases of Borrelia miyamotoi in the country, which were amongst the first 73 in the world, which, it's pretty crazy. And so the first person I saw, who I get to sit down and have this conversation with, we've got this rare infection. We don't really know what to do with it. A few people have already treated it with these antibiotics. She's like, if you don't sign an affidavit that I'm going to die in 48 hours, I refuse antibiotics. I'm all for the herbs, but I'm like, this is like one of the most, at the time, felt to be one of the most rare infections on the planet that has the possibility of killing you or causing severe neurologic damage, and you want me to treat it with herbs. I'm like, all right, let's have at it. And I'll tell you what, the other person who was in that group of 4, because I had 2 and Catherine had 2, man, that dude had multiple antibiotics and herbs, all kinds of stuff, didn't do all that well. This lady had like 2 herbs and did great. And then after 4 months, and then she crashed. And then we added 1 more herbal formula. And then it was like 6 months in is like symptom free. A year later, stopped the stuff. And I just got a phone call the other day. It's like 2.5 years after we stopped, she's still symptom free. And I'm like, man, it just blows my mind. It's like, here it is, like one of the scariest things that I knew of at the time, and the herbs got it done, and relatively quickly. One of the things, Sarah had asked a question if we recommend SSRIs for kids with pandas to help with symptoms. So, I mean, being from, I went to medical school kind of knowing that things were broken. I didn't know about osteopathy. I didn't really, I just happened to know a doctor was super cool. So I went where he went to school. I was like, you're different and I want to be like you. But I didn't know about naturopathy until I got to school. Like I thought everything was so broken that I was going to actually have to be the person to do all the change. I really had no exposure to anything except a little, chiropractic neck cracking, but not even like a lot of the chiropractors I know now are doing much more broad, health supporting things than just a quick neck crack. And so I came into a system where I wanted to learn how we break bodies so that I could not do that. And subsequently, I found out there's a whole bunch of other people that had already been working on that. But in the process, I was trained in some of these modalities. And I say, no matter what I'm starting somebody on, I think of it as a therapeutic trial. I'm going to use it until I find out it doesn't work, they're having a side effect, or it's really good, but we no longer need it. And the only way we're going to stay on it forever is if I find out I can't get you off of it and it's the only thing that works, And so I think there's so many natural substances and so many other approaches, that you can do, from communication styles to, to different therapies. I mean, there's like all this work on the vagus nerve and different things you can do for the limbic system. But there are kids I find that do well on SSRIs, but I find that their parents are like torn apart from having to use them. And more commonly what ends up happening is somebody didn't know what options they had and they got on an SSRI and it's working. So I usually don't just yank people off. I'm like, let's work. All right, so we've stabilized one part of this, the behavioral part of that encephalitis. Let's work on all those other things we've been talking about. And then I'm going to help you wean off of this, because as a lot of you may know, I mean, coming off of an SSRI is like, for some people it's really easy, and for some people it's not at all. There's a lot of withdrawal side effects. So, I find them to be palliative. They work in some people. I don't rule them out. I do prescribe them once in a blue moon, probably like 4 times a year. But the goal is, I think there's a lot of better options, but some children do have some pretty severe symptoms. And, it's like we need stability sometimes, and like IVIG and steroids have their place. If you read a lot of what Sue Sweeto works on, she's seeing these kids who are ballistic coming into like the ER. It's like, if it's a life or death situation, or if somebody's, suicidal, or, they're like going down that road of severe depression, it may be a stopgap measure that you need to consider. But again, I just like to think of it as we use the treatments that we need for the situation, and then we always plan to come off of them unless we really can't. So that's kind of my 52 cents.
Yeah, I appreciate that, Tom. I think, it's important that you have to meet them where they're at. And sometimes we just have to put out fires. I mean, look, again, I'm a naturopath, and there are times I will prescribe steroids. There are times I will prescribe antibiotics. There are some people who are in such dire shape that time is a factor, or their life is so disrupted while we're working on all these other foundational things. We just need to make them comfortable and get them out of or keep them from going to the ER. So if that's what you got to do, and you going in with the understanding that this is, like you said, a stopgap treatment, it's short term, it's really just to get stabilization, and then we're going to work on this other stuff. I think, you do what you got to do, and that's a reasonable approach. I think both of our concern would be is, you just start on the SSRI, and then you're just on it now, and good luck. And this is kind of what happens a lot in conventional medicine, is if you go on a medication, no matter what it's for, if you're doing well on it, the doctor's like, well, you're doing well on it, why would I take you off? Why
would I suggest you modify your diet and your lifestyle and lose 50 pounds? Why is that possible? Why would I think that? Yeah. I mean, it's just so much. I mean, I just think, one of the things I think is important too is when we look at these things, we have the way pain works is like, if you're having a physical thing that causes pain, that you need that there to have pain. But after you have pain for a while from a physical stimulus, you can create a pain cycle where the cycle itself is self-perpetuating in the absence of the original cause of the pain. Similar things happen. I mean, we have feedback loops in the brain where if we're anxious and depressed and nothing can get us out of that, we're going to go deeper into depression usually. It's not mandatory, but we do get these cycles where the more depressed or the more anxious or the more OCD we are, the more we're going to have that, right? And so if we've tried some things and we haven't been able to stop that cycle, that might be a place where we try one of these prescriptions, pharmaceuticals, as a stopgap. And I really love that word. I use it a lot. I can't believe I couldn't remember it earlier. Yeah, and Maria, I'm sorry to hear that, Borrelia miyamotoi, nothing's really worked. I mean, certainly I found that there are a bunch of things out there. So, Maria's saying that she's disabled using a walker, which totally stinks. And, the thing about miyamotoi that's interesting and unfortunate is it does seem to have a lot of sort of brain inflammation, neurologic symptoms, anything from ringing in your ears to hearing loss to things like, Maria's talking about. So, but certainly, I mean, I've seen a lot of cases that have been pretty successful. And I hope for Maria that, you find something that does work for that. And Donna's talking about using LDN for 3 years and not noticing any benefit after that period of time. And, while we can't tell you exactly what to do, Dawn, I know I have a very strong opinion about your comments. I'll let you comment, Darin, and then if there's anything left.
Well, I won't be shy. I mean, with LDN,
either, don't worry.
again, this is not medical advice. This is education. But for people who've been on LDN, if you get up to that 4.5 milligram to 6 milligram dose for 3 months, at that point, whatever you get is what you're going to get. Yeah. If you don't see any improvement at that point, it is not going to work for you. So if you've been on for 3 years, have had no clinical improvement, and you've been up to that higher dose, it's probably time to talk to your doctor about ditching it.
Right. And I talk about reassessment. I mean, I usually say, like, once you get to whatever that particular dose is for you, and the 4.5 is usually what I target, and I'll say 4 to 6 months. I mean, I think you're right. 3 months is probably what you're going to get. But with anything, and this is what I've seen people on 3 antibiotics for 5 years not seeing clinical changes. I understand why some doctors think that people who use antibiotics for longer than 3 weeks think those doctors are crazy. Because it's like we go from one end of the spectrum from you don't have Lyme or you can cure it with like 10 days to open-ended treatment forever. And to me, there's an admission criteria and a discharge criteria. There's a criteria for starting the antibiotic or the LDN, and then we reassess, every 4 weeks, every 6 or 8 weeks. And if that isn't working, why keep doing it? The nice thing about LDN is, I mean, compared to the other, like antibiotics, is the side effect profile for LDN is very close to minimal to, I've certainly seen people with some, but long term, it's probably not a big problem. But I think with any treatment, we need to see that it's working. And sometimes that might take 3 or 6 months. I get that. I've certainly been the person who's provided that suggestion to select patients based on their situation and all the infections, they have in their clinical situation. But we do have to, think about, like, if we're on something for a while, we don't know why we're still taking it. Maybe we want to sit down with our healthcare provider and just find out, does it still make sense or not? Because like you were saying there, a lot of times, like blood pressure medications, like people are on their blood pressure medication and it's like their doctor just leaves them on it. But other people go and they change their diet and their lifestyle, they lose 35 pounds and now they have dizziness and they have lightheadedness, Pardon me. And it's like, and people forgot that, like, they were on the medicine, but then they made the changes necessary to be able to come off.
Right.
So we have to reassess whether it's other things have worked and also whether that medication is working.
Yeah, I think the other thing to consider with any medication or any supplement for that matter, I've seen some people where we start them on something, we reassess, we don't see a tremendous amount of clinical improvement, and they say, okay, well, let's wean off or stop completely. But if you start to see regression, your symptoms get worse. There are some treatments that don't necessarily move you forward, but they also prevent you from moving backwards. And that can be important too. So I've seen this a handful of times with LDN where there wasn't drastic improvement, but people came off, and then within a few weeks they started to notice regression or relapse symptoms. So keep that in mind, that if you stop a treatment and you start to get worse, maybe worth retrying it, see if it does give you stability, because it may be at least doing that for you. And again, if it's a reasonably cost, low side effect treatment, maybe worth keeping on board.
Yeah, and that reminds me, like reading some of the forums on like the results of LDN and Parkinson's in particular. There's a few people that notice like significant improvement, but there's a huge number of people, at least to my recollection, who don't see it helping them get better, but they don't progress.
Yeah.
Right. So it's really unheard of Parkinson's just kind of getting like mild to moderate and just staying there. It's kind of like this slippery slope that works. So I think that it's really important. The point you just brought up is that it could be working to prevent you from getting worse. So, I mean, again, it's a conversation about possibilities, and go back and talk to your healthcare provider, because I don't, neither one of us know your specifics, but certainly it's a great question. Samantha's asking us about gut health, and like we keep talking about it, which I'm glad I'm glad that that's coming across. But what's the priority? Do we treat SIBO? Do we treat mold? Do we treat Lyme? When all of those are sort of in the mix.
Yes.
Yeah.
Yeah. I think we kind of have to take this on an individual basis, and it's always a function of what is the higher priority. I think most of us would probably agree that gut health is foundational for everybody. If your gut's not functioning well, your immune system's not functioning well, there is that trickle-down effect. So at least in my practice, gut is always part of the initial conversation. And then from there, depending on how well the gut is working, what kind of diet they're eating, what I feel like the strength of their immune system is, it's sort of a function too. What do you think each person can handle? I see a lot of people are really very hypersensitive. So you throw a bunch of things at them at once, they just don't react well. So, you just have to kind of take that on an individual basis. But I am not in the camp, and I hear this a lot from other providers. I've heard this a lot, and it makes me crazy. And Tom, I'd love to hear your thoughts on this. You can't treat Lyme until you deal with the mold. I hear this over and over again. I don't know where this came from. I don't know who said it or why. But in my world, it's not true, because if mold affects you and Lyme affects you, the treatments are completely different. They're doing different things. I see no problem of doing multiple therapies simultaneously to get you feeling better faster, because, gosh, treating mold or mycotoxicity could take, a year, 2 years, or longer. And I would certainly hate to delay your Lyme treatment for that long because you've got a mold issue. So I think, when you've got complex illness and potentially multiple etiologies, and you've got a lot of things fueling the flames, you just have to prioritize what is maybe most important. But I certainly wouldn't want to delay treating something I thought was, really significant for somebody.
Yeah. I always try to prioritize too. I mean, do I think it's more Lyme? Do I think it's more mold? I mean, is the gut that much of a mess? I mean, some people, I'm like, I'm doing nothing until we fix your gut, because I can't modulate your immune system because because it's so bad, and I agree. And, a lot of times what I'll do is I'll start working on the gut. Then people are like, when are you going to treat my Lyme and my, and my mold? I'm like, we're doing that. And they're like, no, I know we're treating the gut, and that's like so important. I'm like, yeah, well, it just so happens that the comprehensive cleansing program I have you on for your gut is also been shown to kill mold and and Lyme disease, And so a lot of times what I try to do is layer those treatments together. And another thing too is like, I mean, one of the biggest difficult problems with the mycotoxins is like just clearing them. So a lot of times it's as simple as we're doing a little bit of work on the gut and we put a binder in, and then now we start with our antimicrobials for Lyme. And if you read on this is the other cool part, going back to what you were saying, Darin, about herbs being broader. A lot of herbs are microbial. They're not antibacterial only or antifungal only or antiviral only. And when you read like what's in the antifungal formula, it looks a lot like what's in the anti-Lyme formula, which looks a lot like the anti-Bartonella formula, right? And so like the foundation, a lot of times if you're using tinctures or extracts, the foundational pieces of each one are very similar. Right. And then you change them a bit to get them more specific, So there's a lot of ways to skin that cat. And I think it's, very individual, and it depends. I mean, I've had people where like, I'm like, we got to check for mold. We got to check for mold. We got to check for mold. Like, oh, it's my Lyme and my Bartonella. It's my Lyme and my Bartonella. And they get partially better, but they keep relapsing. And lo and behold, we check for the mold. they've got the mold, we find it at work, we clean that up, and it's like they're 99% better. You know, it would have been really nice to know that, where we could do both in the beginning. Now, I also think there is a subgroup of people who are wicked sensitive. And this goes back to kind of like the balance of the Th1 and Th2 stuff you've been talking about. And, you know, a lot of times, like, and I know Neil Nathan talks a lot about, hey, if you can't get better from Lyme, you got to look at BART. If you can't better from BART, you got to look at mold. And then you're probably going to have mast cell activation syndrome. But these are all happening at the same time in the same body. And so what we try to do is figure out, are there priorities, right? Is there one thing that's the most important to your body, mold or Bartonella? Is it, or is it that we need to do mold, Bartonella, Lyme, strep all at the same time, and that's sort of part of where the clinical art comes in. But I would definitely, I always try to layer things so that we're treating multiple, whether it's antibiotics, whether it's herbals, but the one thing I would also say about that is, I think it's awesome. I find it beneficial, in most cases, and I would leave out like really acute decompensations and brand new presentations kind of out of this, is most of the time it's really important to do sort of modify a few variables at a time, sometimes one variable, sometimes two or three, and not make wholesale 10 or 15 changes all at once, because that's super complicated. But you can make a heck of a lot of changes in a month if you use your patient portal, email, or the phone,
Yeah.
So.
I just saw a comment here, and I think I missed over, from April. I hope you're still on. She says, do you see misdiagnosed kids who are told they have autism, but it was really pandas or pans?
Yeah, I got that on my list too. Great.
I treat a lot of kids with autism, and no. The nature of PANS and autism are quite different. The diagnostic criteria are quite different. So I see a lot of kids with autism that develop PANS. That is very common, but the syndromes are actually clinically different. So I have not experienced that.
Cool. Hey, and everybody, listen to what Dr. Darin just said, right? I am so happy to know you, dude, because you step up and you just stand up for what the research shows and what our clinical experience shows. It's like, when we get these blanket statements that like everybody with autism has Lyme, everybody with autism has PANS, or whatever, that, or everybody has whatever, we need more doctors to stand up and just speak the truth as best we know. And, we do, like you say, they're clinically different. And we need to stand up and do that, because to me, if we're not willing to have that conversation, it's so, how hard is it when somebody comes in your office and they're like, I've got Lyme disease, and they know that's their diagnosis because they've been looking forever, and it doesn't look like they have Lyme disease. It's not information we want to share with people. But if we are, I tell people all the time, I'm not wed to your diagnosis. I want to know, but I need to know what it is, right? So I don't care what the hell you have. I want to help you find it out so that either I can help you with it, or I can find somebody who can help you get over it. But if we're wed to a name or a diagnosis or something we read in a support group or a chat or whatever, that's where we can get into trouble. So Darin, props to just like, we've got the information that can separate these things, and I also think it's important to say, hey, somebody with autism could go on and get bit by a Lyme tick, or could have strep and develop PANS, right? I mean, life happens. And and I'm sure a lot of you folks know watching, it just seems like some days it just, you can't even, the weight on your shoulders is so big, it's kind of like it rains, it pours, and it just keeps on coming. So, but we do need to distinguish some of these things. So that's awesome. What else we got going here? We've got a couple other questions. Actually, I think it'd be really cool if we want to kind of, move towards wrapping up and talking about Diane had a question about stimulating the immune system. If we stimulate the immune system to go after Lyme, or treating Lyme, and we start to work on that, and the immune system's going after Lyme, could we stimulate the immune system to kind of go after our myelin, and the myelin's that sort of the insulation on the outside of our nerves, sort of like the insulation on the outside of a copper wire. And when that falls apart, that can lead to multiple sclerosis, which is kind of like the definition of it. So, and genetically, the tail of the Lyme spirochete is similar to myelin, and some people are thinking that's where we might have some of this autoimmunity, molecular mimicry type of thing. But what are your thoughts on that bad boy, Darin?
Yeah, I think, when we're talking about, well, I like the term immune modulation better. I think what we're really trying to accomplish, it's not stimulating. The problem isn't necessarily that we can't elicit an immune reaction to a bug. Most people who have Lyme and these chronic infections, if they get a cold virus or something like that, their body still fights it, they get over it, and they're fine. So it's not that part of the immune system doesn't work. It's this faulty part of the other part of the immune system that's not working well. So immune modulation is really what we're kind of geared toward. That's why we use things like LDN. That's why we use things like glutathione and so forth. However, we do have herbs in particular that do stimulate part of the immune system. Again, when you're talking about NK cell activation. So this is where things like a lot of the medicinal mushrooms like shiitake, reishi, lion's mane, they're going to activate these T cells or NK cells that directly go right after the organism, and it eats it up and it gets rid of it. Things that stimulate B cells are part of the immune system that make antibodies. So this is where things like echinacea and golden seal, these types of herbs sometimes will be a little bit more careful because they're working at a different level. And this is all theoretical, by the way. There's actually been no research on this that shows that it actually does make these
Right.
But I think those of us on the conservative side say, look, if there's a possibility that we're going to upregulate that antibody response for someone with an autoimmune issue, that may not be a great idea. And I think the fact we have so many other tools in our kit to stimulate the right part of the immune system, now it's just a function of being selective about which therapies you're using. But there is a positive way to stimulate the right part of the immune system to fight the infection without negatively impacting that autoimmune process.
Yeah, I think it's really cool too that, and I know your book has a lot of information on this too, but you're naming like some very specific things, single herbs, mushrooms, either singularly or in combination. There's a lot of combination products out there. I use a lot of them. I use a lot of single things, but I think it's really important that we don't necessarily always need to go for like immune system modulator 2000. Right, that has like every single thing that's ever been potentially immune modulating. And I use some of these products in the right person, but I think there's so much information, and everybody's trying to make the best formula out there for you, or at least that's what I like to believe. I don't know, it's always true, but I think it's so important that like sometimes simple is better, sometimes less is more, and I think that's where like resources like Darin's book and even like these conversations where we can say, mushrooms are pretty potent things, man. And as an example, so I just think it's important to understand that sometimes we don't, because like, and I'm sure Darin, you've seen a lot of people, if you give them like one of these combinations, they have a reaction, and you're like, well, what to what, And so sometimes if we're able to give you a single herb or or like 3 mushrooms rather than 23 mushrooms, you have a better chance of tolerating it because we don't accidentally overstimulate something,
Right.
So
I'm right there with you. I think the less is more approach for most people works really well. Again, it's always easy to layer in things as needed, but start with, a couple things, see how you respond. I'm always amazed. I've had people, who start on just Cemento. They start on cat's claw. That's it.
Right.
And they have an amazing response with just using cat's claw. Well, cat's claw is antimicrobial. It's anti-inflammatory. It's antiplatelet aggregating. So it kind of makes sense chemically of why people would have such a good response. And it's like, yeah, I could have gone in and thrown, 10 tinctures at them, but I just started with 1, see how they do. So, it's always easy to start small and go up if you need it. And sometimes you find you really don't need it. Then it saves people time and money and everything else. So why not?
Well, and, like for folks who know my story, it was like, I almost lost a job because like I wasn't getting any work done. And it started out, it was like, I was in 6 hours, I could get done 14 hours worth of work. And I was just like, they're like, why don't you go home? And it was like, cause I work in outdoor education and teaching kids and I was doing all this cool stuff. But then I ended up like just staring at a wall, like drooling on myself, and all these people, my boss was like, oh, I thought you were just slacking off. And she's like, you need to go see a doctor. and I ended up with this big old rash on me and brain fog. And the guy's like, don't worry, you got Lyme, 10 days, your doxy, you're good. I laid on the floor for 4 days with alternating shakes and sweats and chills, even though it was July. And you know what's really interesting is no one told my parents or myself anything about co-infections or maybe Babesia that might be there. You know, and for the next 8 years, I've got all these crazy symptoms. And then it's like, you know, I dive in and it's like I accidentally run across somebody who does Lyme. And I was just shadowing in their office. I had no clue about it. And at the end of the first day, I'm like, hey, I got whatever these people you're seeing have. And, you know, 8 years later, I still had like floridly positive Lyme. And then I had Babesia infection that no one had ever diagnosed. Thankfully, you know, it became chronic and it wasn't this acute, like life-threatening thing. But it took me another like 5 years to get better. Right. Yeah. So here I am. I'm talking like 13 years of my life. They're not gone. I still did stuff, but man, that sucks. Right. And one of the things that one of the reasons I'm so passionate about doing this is I don't want other people to have to wait 13 years to get better.
Yeah.
Right. Or end up in a wheelchair and try to figure out how to get out of it. Right. And, or, you know, April was saying like my child was diagnosed with autism, but doesn't really fit the mold. And maybe the doctor doesn't know about Pandas Pans. Maybe that's what it is, you know? And so, you know, I just think it's important, but I also think that we have to, what I recognized through my own journey was what you just said, Darin, was so key. Sometimes it's a small thing that makes a huge difference, like the cat's claw or the petunia or the dietary, whatever it is. So it doesn't always have to be like 75 antibiotics and 400 herbs, you know? So I think it's important. But that's like the goal here is to get this information out so that you can have the papers, you can have the understanding to share with your doctors. And a recommendation, like doctors are used to literature. Most people want to help you. It's a suggestion. Here's something I'm wondering about. Could you tell me your opinion about it? You know, when we walk in and my kid has this, some doctors might be cool with that, but others might not take it so well. So just a word of caution.
Yeah. Yeah. I saw April had chimed in again. And do you think most doctors don't know about PANS, so they diagnose a child with autism? Gosh, I would hope not. The criteria is quite different. I think the biggest thing, you know, there's a lot of overlapping symptoms. I mean, children with autism can have, you know, repetitive behaviors. They can have anxiety. Children with autism do not typically have tics. That's not a hallmark of autism. However, there is a lot of overlapping symptoms. However, the nature of PANS is that typically it's something that comes on quickly. It comes on, again, overnight. So if this is something that your child's basically had, you know, most of their life, or it's been this long-standing thing, that could just be a function of how autism presents with them. But if it's something where, you know, they've had autism, they had the features, and then they start developing this next set of features that represent PANS, that I do see a lot. You know, I've seen kids with autism that have the typical, you know, language issues, behavior issues, gut issues, and then all of a sudden now they start developing OCD, anxiety, tics that happened out of the blue. So that's a common scenario. But again, the diagnostic criteria are quite different, and hopefully your doctor understands that difference.
Yeah. Well, thank you everyone for all the thanks over there. There's a whole bunch of thank yous and thumbs up, and we appreciate it. There, you know, we have a question about co-infections. I think it'd be super cool for one of our next ones, you know, like we're talking about doing maybe a kids health special, just like a general one. And then, you know, co-infections is something, I mean, we could talk about co-infections for like 6 years, I think, too. So I think that should be maybe one that I'll put on our list here so that we can, you know, have a specific kind of dive on co-infections. And who knows, maybe we need to like do tick-borne co-infections and opportunistic, you know, co-infections, meaning ones that maybe we're seeing in conjunction with tick-borne illness, but may not be from ticks. I mean, technically, if you have Lyme and Bartonella and strep, they're all co-infections. And then we can dive into parasites and all this other fun stuff. So there's a lot of really cool stuff. So we'll be happy to bring that to all you guys. Other thoughts in closing, Darin?
No, I hope you guys all got a lot of great information from our talk tonight. And, you know, Tom and I are both really happy to share this information. We want everyone out there to get on their path to healing, and hope you're finding this valuable. So, you know, after we close out tonight, you know, again, you got other comments, please post it. Please give us other thoughts of things you'd like us to talk about in the future. We've already gotten some great suggestions. So, we're going to keep doing this as long as people are interested. And I think we've got some great topics coming in the future.
Yeah, it's awesome. So everybody, thanks so much for joining us. If you have any questions, like submit them in the comments, any ideas for things you want to hear in the future. We're going to keep doing this on a regular basis, and maybe we'll get some, some special events in with some other people too, just for some fun. And, but yeah, have a great evening. And again, thanks for joining us.
All right, guys. Peace out.